We're thrilled to see all of you guys here today. This is a much bigger crowd than we anticipated, and we're just so excited to see you. I want to say that we did a session very much like this with local professionals in Calgary a week ago. And so it's so fabulous to be here in Edmonton and making bridges across the province on behalf of survivors here. So like Mike said, I've been researching how to cope well, how to make your life as good as it can be after you've had a cancer experience for about 15 years. And so we started CancerBridges. I was brought to Alberta from Stanford University to really lead this program provincially, not just in Calgary, but in Edmonton and also throughout rural Alberta. We want to really bring the province together around what's best for survivors. But there's really a team of people. So, Mike, there we go.
Press it down there. Down one?
Down one. Ha! So, okay, not a Mac person. Okay. So CancerBridges is really made up of a lot of different kinds of people. So we're a group of professionals who have come together to both research what's best for survivors and also to put together programs based on the evidence that we find in our research so that people can live longer, stronger, get the best out of their life that they can. So you can see on this list there are oncologists and patient navigators and nurse navigators and nurses, a health economist. There are a lot of different kinds of people who've come together around this. This thing is going to drive me nuts, probably. Okay, so the first thing that I want to talk about is who are survivors? And that word may be unfamiliar to many of you. And it is a bit confusing as a word, and some people really don't like it. So I'll talk about that in a minute. And then what is survivorship research? What is survivorship research? So I'll take you through a little bit about of what that's about and also what we're doing here in Alberta. And then I'll talk a little bit about the first project that we've undertaken here in Alberta, our Care Plan project. And this is a really important piece of the equation, so I'm going to make sure, no matter what, that I get to this piece. So a lot of people ask me, if you had one thing only that you could say to someone who's been diagnosed with cancer, what would it be? And this is it. So we'll get to that. And then we'll talk a little bit about resources here in Alberta that we're beginning to put together in a way we hope is easy for you to find out about, easy for you to access. And so without further ado, who are survivors? And does this include me? So we have a website, CancerBridges.ca. And so we'll be talking a lot about this throughout the course of today. One of the things that we put on this website was just a little poll. Have you heard the term survivorship before visiting the website? And so far, most people, 54% of the people who responded, have never heard of it before. And so that tells us that we just need to talk a little bit about what this means. So the way that people talk about the continuum of cancer treatment and survivorship is sort of listed here. And this way of talking about the cancer journey is a part of all of the research organizations, the National Institutes of Health in the United States, the CIHR here in Canada, the Canadian Partnership Against Cancer. Everyone talks about it like this. So there's the prevention phase, the detection phase, the diagnosis phase, the treatment phase, and then this survivorship. So pretty much for a long, long time in the medical research and treatment areas for cancer, they were thinking a lot about this, all of this, but not very much about this. So they were just trying to get you through treatment and hoping that you got through treatment and that you would be well, and then, you know, happy day, they send you away from treatment hoping that you're going to be fine. Well, I think they didn't count on their success, because at this point, there are 100,000 of you in Alberta. 65% of you will live at least 5 years. And so all of a sudden, everybody's waking up to the fact that there's this huge area here where, you know, we really need to be in conversation with you. We need to find out from you really what's going on. How are you doing out there? And also to prepare you for that period. So Julia Rowland, who's the head of the Office of Cancer Survivorship in the United States, she redid this continuum as a circle. So for many people, because of the success of treatment, sometimes this has become a circle. So detection, diagnosis, treatment, survivorship. Part of survivorship is prevention, that you're trying to prevent a secondary cancer. You're trying to prevent some of the side effects that might happen based on your treatments. But sometimes second cancers occur, and then you're kind of back in the loop again. And for many people who are diagnosed with metastatic cancer, this is no longer an immediate death sentence. What happens is that you get treatment, you're in remission for a while, it may come back, you may be in remission for a while again. And so instead of it being a short course, it's a long course, which is great news, but it's also something that people are a little bit unprepared for. So this is Alan Hobson, and Alan is my neighbor. I live in Canmore, and so he is an AML, acute leukemia survivor. And he had a stem cell transplant, which was brutal. He wrote a book about it called Climb Back from Cancer, good book. And so when I first moved to Canada, I invited Alan over for tea. He's an inspirational speaker, and so I had heard him speak at a conference before. And we were talking, and he says to me, oh, what happened to the Mike? Where's the slide? Okay, I'll describe it. There were slides in here that talked about, since he summited Mount Everest, he uses that often in the way that he speaks about things. So he said, so getting through the diagnosis and treatment is about here, like just a few feet off the ground. And he said, this is like climbing Mount Everest. But he said, getting through survivorship is through the roof. He said, this is the hardest thing I've ever done. And so he had given me a couple slides from his talks, you know, that had a mountain and then an even bigger mountain for survivorship. And so this is actually a quote from an oncologist who was a patient. And she says, after my very last radiation treatment for breast cancer, I lay on a cold steel table, hairless, half-dressed, and astonished by the tears streaming down my face. I thought I would feel happy about finally reaching the end of treatment, but instead I was sobbing. At the time, I wasn't sure what emotions I was feeling. Looking back, I think I cried because this body had so bravely made it through 18 months of surgery, chemotherapy, and radiation. Ironically, I also cried because I would not be coming back to that familiar table where I had been comforted and encouraged. Instead of joyous, I felt lonely, abandoned, and terrified. This was the rocky beginning of cancer survivorship for me. So, seems like there are a couple of slides missing in here. Okay, so one of the things, maybe I'll go back to, I think it's on, sorry about this. I meant to read this definition. Philosophically, anyone who's been diagnosed with cancer is a survivor from the time of diagnosis and the balance of life. Caregivers and family members are also cancer survivors. And so really, from the time you're diagnosed, whatever happens, you're considered a quote-unquote survivor. So basically, a lot of people hate this word. We're kind of stuck with this word because that's the way this category is designated. But you caregivers in the audience, you're survivors too. And I just want to take a minute to say, last week when we launched this educational series in Calgary, it happened to be on the 31st anniversary of my husband's death from a malignant brain tumor. And so I too am a survivor. And all of us really, you know, it's up to us to really inform the medical profession about what's important out there, about what it's like to survive cancer, to live with cancer. And so now I can go on and talk about this slide. So basically, only since the mid-1970s have half the individuals diagnosed with cancer been expected to be alive 5 years following diagnosis. And the way you read this chart is this is a percentage, a relative survival rate, or a percentage. So collapsed across all the cancers, about 50% of people will be alive 5 years later. And then for prostate and breast cancer, of course, it's much higher. And you can see over time here, and this graph only goes up to 1998, but over time you can see that there's just a general shift where people on average are living longer. Here in Canada, I was surprised by this statistic. 40% of women and 45% of men in Canada will develop cancer during their lifetimes. And so the 5-year survival rate, the average 5-year survival rate is 63% for everyone in Canada. So that means 63% of people will live at least 5 years. And that has gone up 8 percentage points between 1994 and 2006, basically. So it's really improving. And of course, this increase is going to have healthcare implications, not only for the cost of healthcare, but also for just the burden of, you know, who's gonna be there to answer the questions that everyone has, and what kind of information can we provide for you to make this easier. So like Mike said, currently in Alberta there are about 100,000 cancer survivors. And in Canada there are 833,000 cancer survivors. And this is a little bit older graph, but it kind of pinpoints just how many survivors are in each region. There have been many books now developed on survivorship. Some of them are professional books, but I highly recommend this one. This one was written by a Canadian, and it really is for you. It's really for the cancer survivor. And I think it should be in your handouts. So what is cancer survivorship research, and is this relevant for me? So cancer survivorship research seeks to identify, examine, prevent, and control negative cancer and treatment-related outcomes like depression and pain, lymphedema, sexual dysfunction, second cancers, poor quality of life, and provide a knowledge base about optimal follow-up care and surveillance of cancer survivors. So surveillance meaning get your follow-up tests, you know, the tests that you will have to make sure that you're not developing a secondary cancer, and to optimize health after cancer treatment. So, so basically, it's about prevention, surveillance, and detection. It's about interventions for the consequences of cancer, and also about coordinating between specialists. So one of the things that is really important is communication between your family physicians and the oncology world that you've come from. So you go get treated for cancer, and then you're released back into the general community. You go back to your family physician, but most family physicians did not specialize in cancer treatment. And so they're not altogether sure what you went through, nor are they altogether sure if they're supposed to be the one handling, telling you when to go in for follow-up. And there are a number of side effects of treatment that they don't necessarily know so much about because they haven't specialized in that. So we're trying to make that communication more seamless for people. So one of the things recommended in this Institute of Medicine report on cancer survivorship that came out in 2006 was that when treatment ends, all survivors should receive a summary record and a follow-up care plan. So something that takes you from your oncology treatment and that you can have a record of yourself, you have it in your hand, but it also goes to your family physicians so they understand what you went through, what are the issues for you that are coming from your cancer treatment. And then also that record would reside in the oncology center records also, so that there's a kind of seamless record of, here you are at the end of treatment. So it's become mandatory now in the United States. In 2 years, every cancer patient is supposed to leave treatment with one of these. So everybody's scrambling in the United States to come up with what care plan and summary record, what that should look like. There is on this website on Oncolife, there is a template where you can type in your kind of cancer and it will spit out for you a kind of a care plan. But of course, that's not specialized. So many of the things that we're concerned about in looking at what's going on for survivors is the chronic and late effects of cancer treatment, and these can be physical, psychological, social, and existential. But like I said, many of the treatments end up having some kind of physical effect later on. Could be 20 years later. So what's going on in survivorship research here in Alberta? And so in the past, Linda Carlson started by having a survivorship workshop here in 2007. And I came in 2008. And so I'll tell you about our first study, which is about this care plan that everybody thinks is so important. So the first piece of this care plan is your basic diagnostic and treatment information summary. And so I like to show this cartoon because often there's a miscommunication between patients and physicians, so that without clarity, like without having it all in black and white in language that you can understand, the doctor may be thinking, oh, this is something that requires 2 aspirins, and the patient's thinking this is a brain tumor. So there's a miscommunication often if you don't exactly have all the information written down for what you have experienced. And the follow-up surveillance plan, again, that's about the tests and the kind of monitoring that people should have as they go forward. And so I think this cartoon is also funny. These pamphlets will explain the procedure, and these leaflets will explain the pamphlets. And so a lot of what we're striving for is plain language that anybody can understand, so that it's not some long series of complicated communication that happens for you. And then coping and adjustment recommendations and healthy living recommendations. I think this is kind of fun, dangling the tennis shoes here. And so for this one, the lawyer is saying to the guy, a life sentence isn't so bad. With good behavior, poor diet, smoking, and lack of exercise, you'll be out of here in no time. And so we also included a lot of resources and activities for survivors in the care plan information that we delivered. And so, this is just a kind of a combination of a lot of different things available for people. We also put the care team contact information. So what are the phone numbers that you can call if you have questions once you leave active treatment? And so, of course, also, we'll talk more about the resources in a little bit that are available from our CancerBridges website. So this is just a little bit of a result from our care plan study. We gave this to breast cancer patients and head and neck patients. And we also asked their nurses who delivered the care plan and their family physicians who received it to rate it on satisfaction, usefulness, their emotional reaction to it, and communication value. And so 40 is about the highest that they could have, on the positive end, 40 is about the highest they could have rated it. So you can see that for each of those groups, pretty much they thought it was a win. So we're hoping to, we're working with the head and neck team in order to really specialize, really make that an easy process to leave treatment with this care plan. And also, we hope that there will be another breast care plan grant. And we're working on a rural peer counseling program for people in their survivorship. So basically what we're working with the Cancer Society and also the community oncology portion of AHS to provide live, warm human beings in rural locations where people get released from active treatment, come back home to the rural location, and we will train them and supervise them to just be someone who can help welcome that person back at that survivorship moment when they've left active treatment. And many people feel very lost and very abandoned. And so we want to provide some peer counseling because we know that the psychosocial treatment in rural locations is not great. So here's the part where I want to make sure that you really hear this. So distress, the health and economic burden of distress, and is this relevant for me? So I probably talked a long time and I'm probably about out of time, but let me just go into this. So untreated depression compromises your physiology in ways that can affect your body's immune system. So that's the bottom line. Depression is totally and completely normal when you're diagnosed. Like, everybody gets depressed when they get diagnosed. It's a normal process. It's what we're saying here is just don't stay there. Find a way out of it. Whatever you can do to climb out of that depression, and we don't think it's like thinking positive, we really think it's like really working to resolve whatever the depression is, come through that process, talk to people, express your emotions, really make sure that you've come out of that depression. Exercise and many other things are really effective for that. But we think that staying depressed is dangerous. It's physiologically dangerous. So I won't really go through this, but basically people think that these psychosocial factors can affect depression. That can affect your cortisol. It can affect your circadian rhythms, like your sleep rhythms. And it can affect your immune defenses that guard against tumor progression. There's also an economic burden, so untreated depression increases your medical costs, while treatment for depression is cheap and effective and has large benefits. So untreated depression may be related to early death from cancer. And I published this study last year, and this is with metastatic breast cancer patients. So basically, in the first year of this study, if they were able to decrease their depression level in that first year, so they started at whatever level they started at, but they went down, as opposed to increasing, going up. So how you read this survival graph is at 50 months, the people who increased on depression, only about 30% of them were still alive. The people who were able to decrease their depression, about 60% of them we're still alive. So it's a doubling of survival time. And this is out to 14 years. So basically being able to change your depression level so that it decreases over that year was predictive out to 14 years. And there's not just my study, but many, many studies that have accumulated showing how dangerous the impact of depression is, not only on cancer, but on heart disease. So that now that you know not to stay distressed, how can I figure out if I'm distressed enough to seek help? And Barry Boltz and Linda Carlson and others there in Calgary promoted the assessment of distress as the 6th vital sign, like as important as taking your heart rate. And so they've been really promoting screening for distress throughout the province of Alberta and also across Canada. And one thing you may see is this distress thermometer. And basically, it's just one way for you to rate how distressed you are. But they've really gone to this, which is much more specific. So for pain, tiredness, nausea, depression, anxiety, drowsiness, appetite, feeling of well-being, they have you rate this from, you're doing okay to, this is the worst possible. So basically, if you're between 4 and 7, that's elevated enough that you might want to seek treatment. If you're above 7 here, then you really need to seek treatment. That's a really strong indicator that probably there are professionals here who can help you, and that level of distress may actually be physiologically damaging for you. So I won't belabor this. Now that I know that it's important not to stay distressed, who do I turn to? What programs are available to me? So basically, we have developed this website, so CancerBridges.ca, and then you go to the resources tab. And Mike has been developing this. And so basically, here's the page from Edmonton on our resource website. And so it lists a number of things that are available to you. If you click into the Cross Cancer Institute, you can see a number of the programs that are available here, like the support groups, spiritual care services, arts and medicine. And then he has also developed this calendar, and in the calendar are listed the events of each day that you could participate in. So how do I have some faith that these programs are effective? It's one of the things we're doing in Calgary is researching the effectiveness of these treatments. I'm the survivorship lead. Linda Carlson is the integrative oncology lead, and Barry Boltz is the screening for distress lead. There are also people here in Edmonton who are conducting this research. And so the take-home messages really are cancer survivorship extends throughout your life. The transition periods can be very difficult. We really understand that, want to facilitate that. And untreated distress is expensive and dangerous. Clinical research has demonstrated that the effectiveness of most of the psychosocial programs we offer here through AHS. And we are planning for the future with survivorship programs and care plans, so stay tuned. And of course, one of the most important resources for you are each other. And we really hope through our Survivor Network to connect you with us and connect you with each other. We hope that to really be facilitating a brighter future for you. I just like this cartoon. And this is just thanks to all the funders.
Great. Thanks, Janine.